But first, one more thing about fat-free indulgence in our politics today. Opponents of health reform first said that it was a secret plot to kill old people. Then they said it was a secret plot to take away veterans' health care. Then they said it was a secret plot to take away health coverage just from Republicans. Then they said it was a secret plot to kill women with breast cancer. Casting around for another group of hopefully scarable Americans to try to turn against health reform, it's possible reform opponents have hit a new low this week, targeting disabled children. Republican members of Congress Trent Franks and Cathy McMorris Rodgers held a press conference this week warning that kids with disabilities would somehow become victims if there is health reform. Pressed by reporters as to whether she could actually point to any language in proposed health reform bills that would deny care to disabled kids, Congresswoman Rodgers said no. But she did say that parents of disabled kids are worried it will happen anyway. I wonder why on earth they'd be worried about that. Maybe because people like Cathy McMorris Rodgers and Trent Franks are telling them to worry about it? It may also be useful to note here that kids with disabilities in this country right now, by and large, have government-run health coverage. The S-CHIP program is kids' health insurance. The Medicaid program covers people with disabilities. So when Cathy McMorris Rodgers and Trent Franks tell people with disabilities to be afraid of government-run health care, they're telling them to be afraid of what they've got now. Don't let the truth hold you back from a good scare, though, right? Time for a magic map trick. Ready? Watch this. Here are the 3 states with the highest number of young women getting vaccinated for HPV. About 3 out of every 4 American women will eventually get HPV. It's the virus that is the leading cause of cervical cancer. Now, unlike other types of cancer, cervical cancer can largely be prevented by this vaccine. So these 3 states are doing the best in the country at administering that vaccine on a relatively wide basis. They're doing a good job with that part of healthcare. Good. Now, here are the 3 states that are doing the worst. This is where the lowest proportion of teenage girls are getting vaccinated for HPV. So here, one very effective form of healthcare is relatively lacking. When that data about those states came out today, it got us here thinking. We wondered what other states are really sort of blowing it on women's reproductive health care. Turns out, here's the teenage pregnancy stats. Here are the states with the most teenagers who are now also moms. In these states, more than 15% of babies are born prematurely. And here are the states where the babies are born with the lowest birth weight. If you want to map the infant mortality rate, here are the nation's worst 3 states. Now, magic map trick. If you put all of this data into a big computing machine, which states are offenders in all the above categories? Which states are the worst of all of these worlds? They are Mississippi and South Carolina. South Carolina, the Palmetto State, also home of lawmakers who, perhaps more than in any other state, have staked their reason for being on preventing health reform.
The reason you're not going to have a government-run health care pass the Senate is because it would be devastating for this country.
If we're able to stop Obama on this, it will be his Waterloo. It will break him.
I will not be muzzled. I will speak up and speak loudly against this risky plan.
More than 20% of South Carolinians do not have health insurance. Teen pregnancy rates are among the highest in the country. They are among the worst at getting young women vaccinated for a nearly preventable cancer. Infant mortality among the highest in the country. If anyone might want to get a little help with the disaster that is healthcare in their state, you'd think it would be these guys. But they're the ones who are fighting hardest against it.